Good day everyone. In previous videos relating to stretching, we have discussed the definition, indications, contraindications, determinants of stretching, types of stretching, and PNF stretching techniques. In this video, we'll be discussing the preparation, application, and after stretching procedures. So starting with the preparation for stretching, first of all, we have to review the goals and the desired outcomes with the patient. We have to obtain the patient's consent for the treatment. Then we have to select most effective technique. Before stretching, warm up of the soft tissues by application of either local heat or by low intensity active exercises. So by warming up the tight structures, it will increase the extensibility of the tissues and definitely it will reduce the risk of injury to the patient that could be due to stretching. So patient should be in a comfortable, stable position, and if it is a passive stretching, ask the patient to be relaxed as much as possible. And we have to this is important, the direction of the stretch, it is exactly opposite the direction of the joint or muscle restriction. So we have to explain the procedure to the patient, free the area from any splints, bandages, or any restrictive clothing. And we have to explain the patient that it is important to be as relaxed as possible. Next comes the application of manual stretching procedure. So we have to move the extremities slowly through the free range to point of tissue restriction, and we have to grasp the proximal and distal to the joint in which motion is to occur. Always use the broad surfaces of your hands to apply the forces and firmly stable the proximal segment either with the equipment or manually, and then we move the distal segment. In case it is a multi-joint muscle, then we have to stabilize either the proximal or distal segment to which the range limiting muscle attaches, and we have to stretch the muscle over one joint at a time and then over all joints simultaneously until the optimal length of the soft tissue is achieved. Now we always incorporate a pre-stretch like isometric contraction of the range limiting muscle like hold to relax procedure, and this will definitely relax the muscle reflexively prior to the stretching. To avoid any joint compression, always give grade 1 mobilization distraction to the moving joint before applying the stretching, and apply a low intensity stretch in a slow sustained manner. And we have to maintain the stretched position for 30 seconds or longer, and during this time the tension in the tissues should be slowly decrease. When the tension decreases, move the extremity or joint a little farther to progressively lengthen the hypomobile tissues, and gradually release the stretch force and allow the patient or the therapist to rest momentarily while maintaining the range limiting tissues in a comfortable elongated position. So if the patient does not seem to tolerate a sustained stretch, then we give very slow, gentle, intermittent stretches with the muscle in a lengthened position. And if deemed appropriate, we also apply selected soft tissue mobilization procedures such as facial massage or cross finger friction massage at or near the sites of adhesion during the stretching maneuvers. Now after stretching, we have to apply cold to the soft tissues that have been stretched, and this cold therapy should be applied in a lengthened position. Now cold, it minimizes the post stretch muscle soreness, and that can occur due to the micro trauma during stretching. And when tissues they are cooled in a lengthened position, it increases in the range of motion and they are more readily maintained. So regardless of type of stretching intervention used, the patient perform active range of motion and strengthening exercises through the gained range immediately after stretching. And with the supervision and feedback of the therapist, patient can use the gained range of performing simulated functional movement patterns that are a part of daily living. And we have to develop a balance in the strength of the antagonistic muscles in the new range also. So there could be adequate neuromuscular control and stability as the flexibility increases. And there is one clinical tip, that is that we can't gain the full range in 1 or 2 treatment sessions. So to resolve the mobility impairment, it is a slow gradual process. So it may take several weeks of stretching to see the significant results. So between stretching sessions, it is important to use the newly increased range to maintain what has been gained. Thank you.